Introduction. Welcome to today's lecture on the fascinating field of medical nanotechnology, specifically focusing on the application of nanoparticles and theranostics in stroke treatment. In this comprehensive script, we will explore various aspects including blood-brain barrier permeability, targeted drug delivery systems, imaging modalities for stroke diagnosis, therapeutic agents loaded on nanoparticles, multimodal imaging nanoprobes, inflammation modulation, stem cell delivery, nanoparticle-mediated neuroprotection, biomimetic nanoparticles, clinical translation, and safety considerations. This script aims to provide a detailed understanding of the potential of nanotechnology in revolutionizing stroke therapy. Nanoparticles, defined as particles with sizes ranging from 1 to 100 nanometers, have gained significant attention in the field of medicine due to their unique properties. In the context of stroke, nanoparticles offer promising opportunities for targeted drug delivery to the brain, enhanced imaging capabilities, and therapeutic interventions. Theranostics, a combination of therapeutics and diagnostics, allows for simultaneous treatment and monitoring of stroke progression. By integrating nanoparticles with theranostic functionalities, we can achieve precise and personalized stroke therapy. One of the major challenges in stroke treatment is the limited permeability of the blood-brain barrier, BBB, that restricts the delivery of therapeutics to the brain. Nanoparticles can be engineered to overcome this barrier through surface modifications and size optimization. For example, surface coating with BBB targeting ligands enables nanoparticles to interact specifically with receptors on BBB endothelial cells, facilitating their transcytosis across the barrier. Furthermore, the small size of nanoparticles allows them to bypass the tight junctions between endothelial cells, enhancing their penetration into the brain parenchyma. Nanoparticles serve as excellent carriers for drug delivery, offering several advantages over conventional approaches. They can encapsulate a wide range of therapeutic agents and deliver them to the desired target site with high specificity. By functionalizing nanoparticles with ligands that selectively bind to receptors on stroke-affected cells, drug release can be precisely controlled, minimizing off-target effects and reducing systemic toxicity. Additionally, the nanoparticle surface can be modified to respond to specific triggers like pH, temperature, or enzymes, enabling triggered drug release at the site of stroke. Accurate and timely diagnosis of stroke is crucial for effective treatment. Nanoparticles play a pivotal role in enhancing various imaging modalities used for stroke diagnosis. For instance, superparamagnetic iron oxide nanoparticles can be employed as contrast agents for magnetic resonance imaging, MRI, providing detailed anatomical and functional information. Quantum dots, on the other hand, emit fluorescence when excited by specific wavelengths of light, enabling high-resolution imaging of brain vasculature and neuronal activity. Additionally, nanoparticles can be loaded with radioisotopes for positron emission tomography, PET, or single photon emission computed tomography, SPECT, further improving stroke imaging capabilities. Nanoparticles can efficiently encapsulate and deliver various therapeutic agents to the site of stroke, including small molecular drugs, proteins, nucleic acids, and even stem cells. By encapsulating these agents within nanoparticles, their stability can be improved, prolonging their circulation time in the body. Furthermore, nanoparticles offer protection to the therapeutic agents from degradation and clearance, resulting in enhanced bioavailability and therapeutic efficacy. This targeted delivery system also minimizes systemic exposure and associated side effects. In stroke diagnosis, the integration of multiple imaging modalities can provide comprehensive and complementary information. Multimodal imaging nanoprobes, composed of different nanoparticles loaded with imaging agents adapted to different modalities, enable simultaneous imaging using multiple techniques. This approach synergistically combines the strengths of each modality, improving the accuracy of stroke diagnosis, and allowing for real-time monitoring of treatment response. Inflammation plays a critical role in stroke progression and brain damage. Nanoparticles can be designed to modulate the inflammatory response, contributing to neuroprotection and tissue repair. By incorporating anti-inflammatory agents within nanoparticles, their controlled release at the site of stroke can attenuate excessive inflammation. The surface modification of nanoparticles with anti-adhesion molecules can also prevent the infiltration of inflammatory cells into the brain, further reducing inflammatory damage. Stem cell therapy holds great promise for stroke treatment, but efficient delivery to the brain remains a challenge. Nanoparticles offer a means to overcome this hurdle by facilitating the targeted delivery of stem cells to the stroke-affected area. Loading stem cells onto nanoparticles enhances their stability and viability during transportation, enabling their homing to the site of injury. Furthermore, the surface modification of nanoparticles with stem cell-specific antibodies or ligands enhances their binding to stem cells, improving their delivery efficiency and therapeutic potential. Nanoparticles not only serve as carriers for therapeutic agents but also exhibit inherent neuroprotective properties. Certain nanoparticles possess antioxidative, anti-apoptotic, and anti-inflammatory capabilities, shielding neurons from further damage in the acute phase of stroke. Their small size enables efficient penetration into the brain, ensuring widespread neuroprotective effects. Additionally, nanoparticles can modulate the microenvironment at the site of stroke, promoting tissue regeneration and functional recovery. Nature provides a rich source of inspiration for the design of nanoparticles. Biomimetic nanoparticles, engineered to mimic natural structures and functions, have shown great potential in stroke treatment. For example, nanoparticles coated with erythrocyte membranes exhibit prolonged systemic circulation and enhanced BBB penetration, improving the delivery of therapeutic agents. Similarly, platelet-inspired nanoparticles can efficiently target the injured vascular endothelium, facilitating precise drug delivery and promoting vascular repair. The translation of nanoparticle-based theranostic approaches from the laboratory to clinical practice is a significant step in revolutionizing stroke therapy. Challenges in terms of scalability, reproducibility, and regulatory approval need to be addressed to ensure the safe and effective use of nanoparticles in stroke patients. Preclinical and clinical studies are crucial for evaluating the pharmacokinetics, biodistribution, and therapeutic efficacy of nanoparticle-based interventions, paving the way for their integration into routine stroke treatment protocols. The safety of nanoparticles is of paramount importance for their clinical application in stroke therapy. Extensive studies are being conducted to assess the potential toxicity of nanoparticles and the long-term effects on vital organs and systems. Factors such as particle size, surface charge, composition, and biodegradability play crucial roles in determining the biocompatibility of nanoparticles. Rigorous characterization and comprehensive toxicological evaluations are necessary to ensure the safe utilization of nanomaterials in stroke patients. In conclusion, the field of medical nanotechnology holds tremendous potential in transforming stroke therapy. By harnessing the unique properties of nanoparticles and integrating theranostic functionalities, we can achieve targeted drug delivery, enhanced imaging capabilities, inflammation modulation, stem cell delivery, and neuroprotection in stroke treatment. However, challenges related to blood-brain barrier permeability, clinical translation, and safety considerations must be overcome for the successful implementation of nanoparticle-based approaches. Continued research and collaboration between scientists, clinicians, and regulatory authorities will drive the development of innovative and effective nanotechnological solutions for stroke patients.